Yes, things did get better, but the gap is really quite striking for that. And our finding is that insurance alone does not improve the lives completely of people who live in low-income communities. So if we could have slide one. This is over the last 2 years. Was there a time you couldn't get the needed health care? And as you can see, that it's 12% for all other incomes and 21% if you're low income. Next slide.
And low income is less than $25,000.
Right.
Household or individual?
Household.
Household, right.
And so, as many studies have reported, there actually was an increase in use of emergency rooms across the United States. All of us thought, well, finally you get a card, you get ability to get out, and you don't go there. In fact, they did. But an important finding, so low-income people did before and now use emergency rooms more. But there's a somewhat misperception, and we'll show you in a second, that they go there because that's sort of a habit of where it is. And almost half, 48% of low-income people said this, I went there because I can't find any other place at the hour, the location, where I am to go. And I'll show you in a minute, this is not like this is the great place to go. They know right away. Next slide. This is the rating of the care you get. So the thing is absolutely overstriking. So we're talking about people who are going to emergency rooms, and 39% of the low incomes say the care I'm getting is fair or poor. And that's versus 21% of everyone else. So people are not selecting this because this is the high-end place that they get care. They are really trapped into using a set of services. And I don't think people realize that the use of that emergency room is not just sort of a style we got used to. They're going there for one reason, but it's not a satisfactory end. In the survey, we asked people to rate every site of care they got. Emergency rooms ranked at the bottom. There's nothing else a low-income person has contact with that ranked as low as care for an emergency room. But the numbers grew. The numbers grew because there's not a system there for people to go as alternative.